I want to tell you about two men I met in the same week. Both were 74 years old, both retired, both from the same city, the same demographic, roughly the same income, roughly the same lifestyle on paper. Both had grown up eating similar foods. Neither was a fitness enthusiast. Neither had been particularly disciplined about their health in their working years. The first man, I'll call him Arthur, was on 4 blood pressure medications. His systolic reading averaged 158. He had been told by 2 previous physicians that his blood pressure was genetic and would simply need to be managed forever. He accepted this. He had stopped expecting anything different. The second man walked into my office the very next morning. His name was George. Same age, same city, same generation. His blood pressure, measured that morning, was 118/72. No medications. Not one. He had never taken a blood pressure medication in his life. He was not on any cardiac drugs at all. I spent a long time with both men that week. Not because their conditions required it, because I needed to understand the difference. What was George doing, or not doing, that Arthur was not? What had protected one man's arteries for 74 years, while the other man's vascular system had surrendered to hypertension despite medication after medication? And here is what I found. It was not genetics. It was not luck. It was not some mystery of biology that science cannot explain. It was 5 specific, consistent daily habits that George had maintained, some consciously, some simply, as the way he had always lived, that were doing something measurable and profound for his arterial walls. 5 habits, every one of them available to you. Starting today, stay with me. Because what I'm about to share changed how I think about blood pressure protection, and it might change everything for you too. I'm Dr. Soren. I'm a cardiothoracic surgeon with 28 years in the operating room. I have performed over 2,500 open heart surgeries. And in my career, I have operated on hearts weakened by decades of uncontrolled hypertension, damaged, thickened, exhausted hearts that did not have to end up on my table. That reality is what drives everything I share in these videos. I make these videos because the conversation I'm about to have with you is the one I wish I could have with every patient before they reach my operating table. Most doctors don't have time to explain what protection actually looks like day by day, habit by habit. Today, that is exactly what we are going to do. Here is what most people are never told about blood pressure and aging. Rising blood pressure with age is not inevitable. It is common, extraordinarily common. Studies show that approximately 70% of adults over 65 in the Western world have clinically defined hypertension. 70%. But that means 30% do not. And those 30% are not simply lucky. They are, in ways both conscious and unconscious, doing something different. The reason blood pressure rises with age in most people comes down to a single underlying process: arterial stiffening. Your arteries are made partly of elastin, a protein that gives them flexibility, the ability to expand and contract with each heartbeat. Think of elastin like a new rubber band. Snap it, and it springs back instantly. Leave that rubber band in a hot drawer for 30 years, and it becomes brittle, rigid, unwilling to flex. That is what happens to arterial walls when they are chronically inflamed, chronically overloaded, and chronically deprived of the specific inputs they need to maintain elasticity. After 60, you cannot reverse 30 years of stiffening overnight, but you can slow it dramatically. You can, in some patients, measurably reverse it. I have seen this happen. I have watched arteries on follow-up imaging show genuine improvement in flexibility after specific sustained lifestyle changes. The advice designed for a 40-year-old, exercise more, eat less salt, skips the specific targeted interventions that matter most for a 65-year-old arterial system. That distinction, and what to do about it, is exactly what we're covering today. Number 1, they eat potassium-rich food at almost every meal, not from supplements, from actual food. Here's what nobody tells you about potassium and blood pressure. Most people have heard that sodium raises blood pressure. Far fewer people have been told the equally important truth: potassium directly counteracts sodium's pressure-raising effect inside your arterial cells. Potassium and sodium operate in a continuous balance inside every cell in your body. When potassium is abundant, sodium is pushed out of cells, including arterial smooth muscle cells. When sodium leaves those cells, they relax, they dilate, blood pressure drops. This process is called the sodium-potassium ATPase pump. That means the biological mechanism that uses potassium to actively flush sodium out of your cells. At 40, this pump runs efficiently even on a moderate potassium intake. After 60, the pump slows. It needs more potassium to do the same work. And the average adult over 65 consumes less than 60% of the potassium their aging arterial system requires. George, the man with the 118/72 blood pressure, ate a banana every single morning. He ate cooked spinach or kale at least 5 dinners per week. He ate baked potatoes with the skin on twice a week because, as he told me, he simply liked them. He had no idea these foods were protecting his blood pressure. He just liked how he felt. A study published in the American Journal of Hypertension found that adults over 65 who consume 3,500 milligrams or more of dietary potassium per day, the amount in roughly one banana, one medium baked potato with skin, and 1 cup of cooked spinach, had systolic blood pressure readings averaging 11 points lower than matched adults consuming under 2,000 milligrams daily. The fix is precise. Every day, build your meals to include at least 3 of the following: 1 medium banana, 1 medium baked potato with skin, 1 cup of cooked spinach or Swiss chard, 1 cup of cooked lentils, half an avocado, or 1 cup of plain tomato sauce with no added salt. Track this for 2 weeks. Do not take a potassium supplement. Food-sourced potassium is absorbed and balanced differently, and high-dose potassium supplements carry their own risk after 60. Food only. Consistent. Daily. Number 2. They never eat a full meal within 2 hours of physical activity, in either direction. Let me ask you something. If you walk in the morning, when do you eat breakfast? Before? After? Immediately after. Here's what surprises most of my patients when I explain this. The timing of food relative to physical activity has a direct and measurable effect on blood pressure regulation, particularly after 60. When you eat a full meal and then exert yourself, your body simultaneously redirects blood to your digestive system for absorption and to your muscles for movement. These two demands compete. Your heart must work harder. Blood pressure spikes acutely. In a younger person, that spike resolves quickly. In a person over 65 with already stiffer arteries, that spike is higher and takes longer to resolve. The reverse is equally true. If you exercise intensely and then eat a large meal immediately after, your arteries are in a state of post-exertion vasodilation. That means expanded and low pressure from the activity. A large meal triggers a sharp insulin response and redistributes blood to the gut. The rapid transition between these two states, dilated and quiet to suddenly working hard again, is a blood pressure roller coaster that an aging arterial system manages poorly. A study published in the Journal of Human Hypertension found that adults over 65 who ate within 45 minutes before or after moderate exercise had systolic blood pressure spikes averaging 14 points higher in the subsequent 2 hours compared to those who maintained a 2-hour gap between eating and physical activity. That is a meaningful, daily, completely preventable blood pressure burden. The fix: establish a simple rule. No substantial eating, more than 200 calories, within 2 hours before or 1 hour after any exercise or brisk activity. Before exercise, if you need something, drink 200 ml of water with a small pinch of sea salt and eat at most a small handful of raw walnuts, 30 grams, no more. After exercise, wait 45 to 60 minutes before your full meal. Let your arteries complete their post-exercise recovery before you load them with the demands of digestion. Have you ever noticed a flushed feeling, a headache, or unusual fatigue after eating and then going for a walk? Write it in the comments. I read every single one. Number 3. They sleep between 7 and 8 hours, and they protect that sleep with a specific evening routine. Here's what the standard advice gets completely wrong about sleep and blood pressure. Most people are told that sleep is important for blood pressure. Very few people are told why, specifically in a way that makes the mechanism undeniable. So let me make it undeniable. During deep sleep, particularly the slow wave sleep that dominates the first half of the night, your blood pressure drops by 10 to 20% below your daytime average. This is called nocturnal dipping. That means the normal, healthy overnight reduction in vascular pressure that allows your arterial walls to rest, repair, and recover. This nightly dip is when your endothelium regenerates, when inflammation is cleared, when the damage from the day's pressure spikes is partially repaired. Adults who are non-dippers, who do not experience this nighttime reduction, have dramatically accelerated arterial aging. I have seen this with my own eyes on the operating table. Arterial tissue that tells the story of continuous, unrelenting pressure. No rest, no recovery, no repair window. After 60, disrupted sleep, caused by pain, anxiety, poor sleep habits, screens, or unmanaged sleep apnea, eliminates or reduces that nocturnal dip. Your arteries receive no repair window. They age faster. Blood pressure climbs higher, year after year. A study published in the Journal of the American Heart Association found that adults over 65 who slept fewer than 6 hours per night or whose sleep was frequently fragmented had a 62% higher rate of developing stage 2 hypertension over 5 years compared to those sleeping 7 to 8 uninterrupted hours. The fix: build a specific non-negotiable sleep protection routine. By 9 p.m., no screens, phone, television, tablet. The bedroom temperature set between 65 and 68 degrees Fahrenheit, 18 to 20 degrees Celsius. A consistent sleep time and wake time, 7 days a week, within 30 minutes of each other. And the physiological sigh breathing exercise. Full inhale, second shorter inhale, slow exhale over 8 seconds. Done for 5 minutes in bed before sleep. This specific breathing pattern activates your parasympathetic system, your body's sleep signal, faster than any over-the-counter sleep aid, with none of the blood pressure side effects. Number 4, they manage anger and frustration differently than most people, and they do it physically. Here's what nobody tells you about emotional regulation and arterial health after 60. Every time you experience acute anger, frustration, or unprocessed resentment, the kind that sits in your chest and doesn't fully discharge, your body activates what is called the sympathoadrenal axis. That means the stress response system releases a surge of adrenaline and cortisol simultaneously. Blood pressure spikes, heart rate accelerates, your arteries constrict sharply. In a younger person, that spike resolves within 20 to 30 minutes. In a person over 65, the adrenaline clearance is slower. The cortisol persists longer. The blood pressure remains elevated for 90 minutes to 2 hours after a single episode of acute anger. Multiple episodes across a day, an argument, a frustrating phone call, a traffic incident, an upsetting news story, produce a profile of repeated, sustained hypertensive events that look, on a blood pressure log, like treatment-resistant hypertension. What would I recommend for my own parent if they experience this pattern? I would not recommend meditation, though that has its place. I would recommend something physical, because physical movement is the only mechanism that metabolizes adrenaline quickly. When adrenaline is produced by the stress response, it is designed to fuel physical action, fight or flight. The fastest way to clear it from your bloodstream is to give it what it was designed for, movement. George told me that whenever something upset him, he went for a 10-minute walk. He had done this for 30 years, not because anyone told him to, because he had noticed it made him feel better. He did not know he was clearing adrenaline from his arterial system. He just knew the walk worked. A study published in Psychosomatic Medicine found that adults over 65 who engaged in 10 minutes of brisk walking within 30 minutes of an acute emotional stressor had cortisol and blood pressure returned to baseline levels 47% faster than those who sat still or attempted distraction techniques. The fix: the next time something angers or frustrates you, and there will be a next time, go outside and walk briskly for exactly 10 minutes. Not a stroll, brisk enough to slightly increase your breathing rate. You are not exercising for fitness. You are metabolizing a chemical that is actively damaging your arterial walls if it is allowed to sit. Number 5. They consume magnesium consistently, through food, not by chance. Here's what surprises most of my patients most profoundly when I explain this. Magnesium is the most important mineral most people over 60 have never deliberately consumed. It is the natural calcium channel blocker. That means it relaxes the smooth muscle in your arterial walls in exactly the same way that some blood pressure medications do, but through a mechanism your body knows and manages naturally. When your arterial smooth muscle cells have sufficient magnesium, they relax, they dilate, blood flows through with less resistance. Blood pressure comes down. When magnesium is insufficient, which, studies show, describes approximately 68% of adults over 65 in Western countries, those smooth muscle cells remain in a state of low-grade, chronic contraction. Permanently mildly contracted arteries, permanent mild to moderate hypertension. Earlier in my career, I prescribed magnesium supplements freely and indiscriminately. I have since learned that magnesium supplementation in the wrong form, magnesium oxide, which is the cheapest and most common, has an absorption rate of only 4% in adults over 65. 4%. The rest passes through unabsorbed. I was not helping my patients. I was giving them expensive urine. A study published in Hypertension found that adults over 65 with adequate dietary magnesium intake, above 400 milligrams per day from food, had systolic blood pressure readings averaging 8.7 points lower than matched adults with low magnesium intake, independent of all other dietary variables. The fix is specific. Every day, eat at least 2 of the following magnesium-rich foods: 1 ounce of dark chocolate with 70% or higher cacao content that delivers 64 milligrams of magnesium, 1 cup of cooked black beans, 120 milligrams, 1 ounce of pumpkin seeds, 156 milligrams, 1 cup of cooked quinoa, 118 milligrams, or 1 large bunch of cooked Swiss chard, 150 milligrams. If you genuinely cannot reach 400 milligrams through food, supplement only with magnesium glycinate, not oxide, at 200 milligrams taken with dinner. That form absorbs at a rate above 80% in adults over 65. The difference in form is everything. Let me tell you what happened to Arthur, the man from my opening story. the 74-year-old on 4 blood pressure medications. After meeting George that week, I went back to Arthur's file with new eyes. I called his office and asked if he would come back in. Not for a procedure, for a conversation. He said yes. I sat with Arthur for 40 minutes. Not 7, 40. I asked him about his food. He ate less than 1 piece of fruit per day, most days none. He skipped breakfast. He walked rarely, maybe twice a week, and never after stress because, in his words, by the time something upsets me, I don't feel like walking. He went to bed at different times every night, often after midnight, often with the television on. And his diet, reviewed item by item, contained almost no deliberate magnesium, processed foods, convenient foods, foods that taste good but give the arterial system almost nothing to work with. 4 medications. And not one physician had sat with Arthur long enough to ask what he was eating when he was sleeping, or how he was managing the stress of a life that had, since retirement, become quieter on the outside, but considerably louder inside his own head. We built a plan. Bananas and baked potatoes added deliberately. A 2-hour meal activity gap established. A 9 p.m. screen curfew implemented. A 10-minute walk protocol after any significant frustration. And magnesium glycinate at 200 milligrams with dinner. 11 weeks later, Arthur's average morning blood pressure had dropped from 158 to 134. His cardiologist reduced one of his 4 medications. 3 months after that, a second medication was reduced in dose. Not eliminated, not yet, but moving in the right direction. Arthur called me on a Tuesday afternoon. He said he had just come back from a walk. He had argued with his son about something on the phone, a small disagreement, the kind families have, and instead of sitting with it, he had walked 10 minutes. And the tension had left him. He sounded different than the man I had met. He sounded lighter. He said, George was right all along. He just didn't know why. That is the entire message of this video. Some people stumble into the habits that protect their arteries without ever knowing the science behind them. Now you know the science. Now you can choose those habits deliberately. Let me bring this together simply and clearly. 1. Eat at least 3 potassium-rich foods every day. A banana, a baked potato with skin, cooked spinach, lentils, or half an avocado, and do it consistently, not occasionally. 2. Maintain a 2-hour gap between any substantial eating and physical activity in either direction. No large meals within 2 hours before exercise, and wait 45 to 60 minutes after exercise before eating fully. 3. Protect 7 to 8 hours of sleep with a hard 9 p.m. screen curfew, a consistent sleep schedule, and 5 minutes of physiological sigh breathing in bed before you try to sleep. 4. The next time something genuinely upsets you, walk briskly for 10 minutes within 30 minutes of that emotional moment, not as exercise, as adrenaline clearance. 5. Add 2 magnesium-rich foods daily. Dark chocolate at 70% cacao, pumpkin seeds, black beans, quinoa, or Swiss chard. And if supplementing, use magnesium glycinate at 200 milligrams with dinner only. Start tonight with the easiest step. Buy a bunch of bananas. Put them on your kitchen counter. Tomorrow morning, that banana is the first food you eat. 1 piece of fruit, roughly 422 milligrams of potassium. 1 small step toward the 3,500 milligrams that protects your arterial walls every day. 1 banana, tomorrow morning. That is where your protection starts. Your body has been working for you every single minute of your life. Give it what it needs. It will respond. If this video gave you something real, share it with someone you love. A spouse, a sibling, a friend over 60 who has been told their blood pressure is genetic and simply something to manage forever. That one share might be the most important thing you do today. And tell me in the comments, which of these 5 habits do you already practice? Which one surprised you most? And which one are you going to start first? I genuinely want to know. Because people who protect their arteries without knowing why deserve to understand what they have been doing right. And people who have not yet started deserve to know that it is never too late to begin. Everything I've shared today is general medical information based on published research and my clinical experience as a cardiothoracic surgeon. It is not a replacement for your personal medical care. Every person's situation is unique. Before making any changes, especially to medications or supplements, please have a full, honest conversation with your own doctor. That conversation, informed and unhurried, is exactly where good medicine begins.